initially I set out to understand the economic and health impact of unsafe abortions in Uganda. And that work sort of had two steps. The first step was to see what the costs or the economic impact in terms of costs on the country would be, and that's a complete study that's been published that basically showed that unsafe abortions impart a substantial impact in terms of costs to the country. But we recently received more funding to try and do an analysis that sort of tries to understand the short term, in about 1 year after having had an unsafe abortion, health and economic impact. So to see whether abortions have an impact on quality of life, on the health of women, and on their economic activity in terms of their labor force participation and their school participation, so those kinds of things. And then the other stream of research was to understand the cost effectiveness of increasing contraceptive coverage. And the study from that question is also going to be published soon, and it showed that increasing contraceptive coverage to basically universal levels is highly, highly cost effective. It in fact dominates not having contraception because it leads to improved health outcomes, improved reproductive health outcomes at a saving, so at a smaller expenditure. Abortion has a set of impacts that are immediate, things like bleeding and infection, and that occur in the hospital. But then there's also this other impact that happens once women leave the hospital. Obviously, people die. Women end up dying and having damage to their physical and mental health as a result of the initial hospitalization. But there are also these other impacts, such as stigma, which is a kind of a social impact, and they also have economic impacts. Women are sick and they can't participate in the economy. And then, of course, there are the health impacts, long-term health impacts like infertility and chronic infection. So there's all those kinds of things. And the compounded effect of all these is that women end up being less well off in general. And this has both impacts to individuals, to families, but also to the country in general. So the question of how abortions affect women is really quite a broad one, but I would say that there's a well-documented negative impact on women at an individual, family, and a national level. That was quite a challenging research question, trying to understand how to get at the cost effectiveness of a contraceptive program. So at the end of the day, my mentors and I chose to go with what they call a Markov model, which is a model that basically puts women in a set of discrete states of reproductive health. Things like contraception, pregnancy, and basically a state of non-contraception. So different health states. And then the model allows women to move through these health states over their reproductive health experience. And the advantage of this modeling technique is that it allows one to capture events that occur multiple times, like births, like abortions. And so this model allowed us to take the reproductive health experience of girls from when they're 15 years to when they are 50 years, essentially menopause, and then take a cohort of women through this model for that period of time under a new contraceptive program and the current contraceptive program. And it allowed us to then calculate the differences. And the results of the study show that, if you have universal access to contraception, you not only reduce the number of births and the number of pregnancies, but you also reduce things like abortions and you reduce the money spent. So this advantage happens with a reduction in the outlay, the monetary outlay over the life experience of women. Our studies show that the impact of reproductive health and population on development may actually not be as strong as the reverse impact, the impact of development itself on reproductive health and on population. Because mainstream development, which has many components, things like physical infrastructure, education, improved healthcare, governance, improved participation in the labor force, all these things ultimately lead to women requiring to, finding the need to have fewer children, and that has a reduction in population impact, and that then has an impact on improving reproductive health. So while you can have these policies like safe abortions and contraception, their impact, in fact, may not be as strong as the impact of mainstream development, the regular trajectory of economic development has on population and on reproductive health. So that's kind of what I learned from our studies, even if it's a positive thing, but understanding that, you know, improving contraceptive coverage and having abortion-friendly policy in itself won't lead to development, but development will, in fact, contribute a lot to improving the health of women in poor countries. So we have studies that show that abortions are very costly to the country, to the Ministry of Health and to society in general, and that improving access to safe abortions and increasing contraceptive coverage are good things. They are good bang for the buck, if you like. And these kinds of policies might actually improve the plight of women in Uganda. So using the bang for the buck argument, I think, has a good chance of catching the attention of policymakers. But also, ultimately, I hope that, you know, in a country like Uganda, where we really don't have in the next 5-10 years the chance of putting legalization of abortion on the agenda, but I hope that, you know, these kinds of studies can at least begin to, you know, sort of incite people into going in that general direction. Ultimately, that general direction has to be gone into.